Right
Okay.
here. Once you've done reading this slide, tell me, I'll change. Move to the next one.
Okay. Okay.
Okay. All right here.
Next slide.
Okay. Now time's gone. Please tell me, consider if you have read and understood, considering it critical care scenario, please tell me how would you manage this patient now? Please tell me how would you manage this patient? What would be the steps to manage a patient in a critical care environment? I can't hear you. Can you unmute yourself? Your voice is gone. Could you please tell me how
Okay.
would you manage your patient?
Yes, ma'am. The patient should be managed according to CCRIS protocol.
Okay. Yes.
Starting from I would check the after I'll ask the name of the patient. If the patient is able to answer his name, then I would that means airway is clear. Then I would proceed to breathing. On breathing, I would check both the chest for movement. I would ascertain the position of the trachea to see if the trachea is in the center, and if the chest is bilaterally moving equally, then auscultate and listen for the sounds to see side if the airway is clear. And after making, I would, because the patient is in this scenario, patient is in dyspnea, so tachypnea. So I would ask the nurse to start the patient on oxygen. Then I would, then after making sure the saturation is good, oxygen is flowing good, and then I would go to circulation. So in circulation, I would start the patient on white. I would check the capillary filling time, blood pressure, and I'll ask for vitals.
Okay.
So here the vitals is
Yes, thank you.
high.
Can you tell me
So
once?
I would start the.
Yes, thank you. Please tell me, considering the patient situation, what are your provisional diagnosis? What are the provisional?
This patient is an acute pancreatitis.
Okay.
Acute pancreatitis.
And what are the other differential diagnoses you'll consider?
There might be a possible peptic ulcer perforation, or it can be other hollow viscous perforation like intestinal perforation.
Okay, perforation is one, perforated viscous. Other, it could be acute cholecystitis, ascending cholangitis, etc. All right. Even could be polycystic cyst. Anyway, please tell me, right, can you please tell me what is the, okay, what are the causes of acute pancreatitis?
Gallstones, which is the most common, can be of idiopathic cause. It can be trauma.
Yes.
It can be any drugs.
Medication. All right. Yes.
It can be toxins, scorpion,
yes. Even infections. All right.
scorpion.
Please tell me the pathogenesis behind acute pancreatitis.
So it can be because of obstruction or infective obstruction period due to gallstones. There will be retrograde flow of the secretions into the duct, inflammation of the ducts and acini, and that will lead to coalition of the molecules, which leads to activation of trypsinogen to trypsin, and that
Okay.
further leads to inflammation of the ductal acini and increase in secretions.
Right. Please tell me how many criterias you know of which can help you in establishing your diagnosis.
Ranson score,
Okay.
Apache 2 CT severity index, Balthazar grading,
Yes. And
Glasgow scoring.
Glasgow criteria. Please tell me Glasgow's criteria.
Age is less than 55, I think so.
Greater
Age less
than
than 55.
greater than
Then
55.
WBC, oh sorry,
Okay.
greater than 55.
Right.
And this
Partial pressure of
glucose,
oxygen should be less than 8
more
kPa.
than 60.
No, you
Oh,
can
less
come
than
back
8
to
kPa.
this one
Okay.
later. You're mixing it up. Please tell me that
I'll come back to
what
this
might
later.
be the causes. What might be the cause of hypocalcemia in patient with acute pancreatitis? What is the cause
There'll
of?
be
Yes.
saponification of the
Very good.
lipids.
Fat. Yes. And
There'll be saponification of fat, and
very good. That leads to
that lead to consumption of the calcium.
no.
I-
Well, you
not
can
sure.
okay. That leads to release of pancreatic enzymes, and then
Okay.
you can okay.
Okay.
You can read that later, and please. All right. Please tell me. This patient is tachypnic. What might be the cause behind it?
Okay.
Tachypnia.
Okay. So that can be due to ARDS. It can be due to
before
acute
that,
respiratory distress syndrome,
abdominal
which is
pain and stimulation of what?
pain and
Sympathetic overdrive.
stimulation of the sympathetic
Yes.
overdrive.
ARDS was correct
Yes.
with VQ mismatch.
VQ
All right,
mismatch,
okay.
and it can be pancreatic effusion also.
Please
Pancreatic
tell
effusion.
me, if you fail to manage this patient, what are the complications that you could expect? Complications
It can lead to
of
it can lead to pseudocyst formation. It can lead
right.
to erosion into the vessels and lead to continuous bleeding.
No.
It can lead to infection and sepsis.
Okay.
It can lead to ARDS.
Okay. And
Acute
every
renal failure.
individual organ is affected, so you can
Yes.
learn more later. Please tell me, how would you take care of the nutritional status of the patient, of this particular patient?
This patient in acute scenario like this, I would put the patient on nil per oral status, and nutrition should be, and put the patient on total parenteral nutrition.
Very good. Yes.
Then after the patient becomes stable, then I would start early enteral nutrition as possible.
Okay. Right. Please tell me, how would you determine? Last question. Please tell me, how would you determine if patient has established or formed pseudocyst?
The time duration is 4 weeks for the pseudocyst to form.
Okay.
After there is an acute pancreatitis, I would wait for 4 weeks.
All right. And
then I would do an imaging to confirm.
Okay. Imaging.
The thickness of the wall.
And?
Imaging to confirm the thickness of the wall.
Yes.
And I can
amylase.
Amylase level will come down.
it doesn't come down. Come on.
Oh, it remains high.
It
Sorry.
remains high. Yeah, you're mixing up. And what else? There is another level which becomes low.
Lipase. Lipase.
No.
CRP
C,
levels.
yes. And C125, that's a tumor marker.
Okay.
Right. Right. Okay. Bell has gone. Thank you.
Okay. Thank you.
Right. You know
Uh,
how to read read this graph, right?
No, this I'm not sure about this graph.
Have a look closely. There is mild pain is 1, moderate pain is 2, severe pain is
Okay.
3. So here is the pain score given.
Great.
Estimated age 65. Patient's detail are given like this: blood pressure, heart rate, temperature, pain score like bowel, oxygen saturation, respiratory rate, heart rate, urine output. So this is whole monitoring
Okay.
output. And these are the scores of heart rate, respiratory rate, systolic blood pressure, CNS response, urine output. So that gives you an idea in what level of shock
Okay.
patient is. So
Okay.
that's, you can have a look at it later. Good.
Okay.
Thank you.
Okay. Thank you.